Do non-steroidal anti-inflammatory drugs affect fracture healing? Hello and welcome to this edition of Urgent Bites, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose, and this week I'm asking the question, should we use non-steroidal anti-inflammatory drugs to treat the pain from fractures? Now, I don't know about you, but this is a quandary that has been raised numerous times over the years. I've come across some orthopaedic surgeons who advise strictly against their use, and some who don't. So I thought an Urgent Bite was a good place to raise this question amongst the urgent care community and have a look at some of the evidence. Inflammation plays a key role in fracture healing, in particular prostaglandins. Now, there's a school of thought that the effect of NSAIDs on inhibiting COX-1 and 2 may play a role in preventing or delaying fracture union, and indeed there have been some animal studies that have found evidence of this. I've attached a few links in the show notes that are worth reading. One of these is a clinical inquiry from the Journal of Family Practice written in 2011. They reviewed the evidence at the time and felt that there was no evidence to suggest that short-term use of NSAIDs caused delayed fracture union. They also raised the possibility that the relationship might not be causal, because fractures that are going on to be non-healing are probably more painful, which result in patients using more analgesia. I've also attached a clinical question from the Canadian family physician from 2014 that asks the same question, and they feel that NSAIDs for the short-term relief of fracture pain are also suitable. And the final link is from a literature review published this year in the Journal of Clinical Anesthesia. They look at the last 38 years of studies relating to post-operative healing of fractures and spinal fusions in patients receiving NSAIDs, and whilst they acknowledge the animal trials, they found that the human trials did not show strong evidence of increased non-union rates, although there was a lot of conflicting data. They call for more randomized controlled studies, but they state that short exposure to NSAIDs is most likely not deleterious. So I'd be interested to hear your feelings on this topic. Do any of you avoid NSAIDs altogether? What is your local orthopaedic department guidelines? And if there's any orthopaedic surgeons listening, they could give their input too. Please email podcast@rnzcuc.org.nz with your thoughts and feedback, and if we get enough, we'll endeavour to do a follow-up podcast discussing the feelings from the urgent care community. Please make sure you've subscribed to the podcast if you can, and check out the show notes for links to the papers mentioned today. Look out for our main podcast on the last Friday of the month, and you'll find an Urgent Bite each Friday in between. I look forward to seeing you all then, but for now, thanks for listening.